now I would like to how to handle the catheter movement. Rule of thumb is when you put your catheter inside the body, rule of thumb is if the tip of catheter doesn't move, do not push the catheter. That is very, very important for the safety of the patient. And second rule is you need to move catheter very, very slowly. Generally, I would recommend to my fellows move catheter 1 millimeter and wait 3 beat cardiac beats. Ablation procedure is mainly done by left hand, not right hand. Right hand is very crude movement, deflect down, curve up, and clockwise counter rotation. But if you move to the target area, you can use right hand. You manipulate catheter for the proper contact and precise mapping and ablation. The left hand is more important. So watch my hand. Use third and fourth finger grab around the sheath, and the thumb finger and index finger grab the catheter. And the clockwise and counterclockwise torque was done by like this. So left hand is more. Because the curvature to left upper pulmonary vein and the right side upper pulmonary vein is easy because it is natural curve. So if you put just push the grid catheter, push. If it is not the appendage side, it naturally going to the left upper pulmonary vein. But make sure if the catheter tip moves directly to appendage, the tip of catheter did not move outside of the cardiac silhouette and on the fluoroscopy. So always you try to gently clockwise torque and push the catheter, and you can put your catheter inside the left side pulmonary vein. Another tip is you need to watching the electrogram signal. Appendage signal is broader and big amplitude. If you see the broader and the big amplitude, you should not push catheter. It is appendage, not the left upper pulmonary vein. And if you move to the right upper pulmonary vein, just clockwise torque whole system, and your catheter will move to the right side pulmonary. So if you curve down clockwise torque, make a posterior inferior drag, and just push the catheter. If you are lucky, you can put your catheter inside the left inferior pulmonary vein. But sometimes, if pulmonary vein is flat, very flat and the narrow diameter, it is hard to push the grid catheter inside. In that case, make a big curve like this, and clockwise torque directed posterior, and push. And if the tip of your grid catheter is just inside the left inferior pulmonary vein ostium, you can just keep the same position of sheath and push the catheter slowly and open the curve. Push catheter and open the curve, and you can get the left inferior pulmonary vein. Okay, from right superior pulmonary vein to right inferior pulmonary vein, imagine where is the patient right inferior pulmonary vein located. It is more posteriorly directed. So if you want to move your catheter posterior direction and from right superior pulmonary vein to inferior vein, deflect down and counterclockwise torque and direct posteriorly, and then you move to your fluoroscopy to the RAO view, and you can see where is your catheter position, tip directed right inferior pulmonary vein. Sometimes it is very difficult, especially in small left atrial size. Then you should curve down, make a sharp curve, even this kind of sharp curve, and direct the right position to right inferior pulmonary vein also, and open the curve. And then catheter is moved inside the right side pulmonary vein with this position. It's not easy to put the inferior pulmonary vein engagement. You need to watch your angiogram you took at the beginning of procedure and imagine where is the patient's inferior pulmonary vein located, and probably you will succeed.